A crown is something which is placed on top of a tooth like a cap, which is used to provide the tooth with additional strength or to restore the tooth back to its natural form, size and function. Generally, teeth which have crowns are normally teeth which have been heavily filled in the past, heavily restored, or are teeth which are broken down and need to be built back up again to improve function or to improve aesthetics. In the past, traditionally it was made of metal or porcelain over metal. Nowadays we tend to use a lot more just fully porcelain. So there's pros and cons to each material. Here at the practice, generally we work with porcelain materials because they're very strong, they're super thin, and they also look the best as well. In the past, a lot of metal materials were used, particularly on the health service. You would have a metal crown or a porcelain over metal crown, which essentially is metal underneath with some porcelain around it to help to make it look a bit better. But what happens over time is that you can start to see some of the metal which comes through on that. So a common complaint from patients is that they have an old crown which has got some metal shining through and they don't like it anymore. And that's what we can normally replace it with, a fully porcelain crown, which is much better. The tooth we can bond on it as well, can be conservative to the tooth structure as well, and tends to give you the best aesthetic outcome. So the procedure for a crown, basically it starts the same way every procedure normally begins the practice, with a new patient examination. So that's where patients come in, we'll take some x-rays of the teeth, we'll do a thorough examination and we'll have a look at teeth. And it may be one of two ways. It may be that the patient presents with a tooth which is already fractured or broken down, or it may be a case that we see a tooth which is heavily filled, which has some little cracks in it, which we think that may break in the future, and we may recommend a crown for you there. Normally the procedure for a crown involves 2 appointments over the course of 2 weeks. So we do the x-rays, we do all the tests to make sure the tooth is nice and healthy. We get you back in, we prepare the tooth for a crown. What that involves is removing any old bits of filling or decay which is inside of the tooth, and then cleaning everything up. We take a digital scan of the tooth, so no more impressions or molds like you would have had in the past. And then you have a temporary which is placed in the tooth for 2 weeks. And then we get you back in basically to fit the crown in. So normally about 2 weeks for a crown. The temporary material, while that's in, generally you do have to be a little bit more careful with what you're eating, what you're drinking. You know, it's not as strong as the crown is itself, so nuts and things like that you have to be a little bit careful with. But generally then, hygiene wise, it's normally okay. We normally will leave it so that you can keep it nice and clean. Once the crown is fitted, then it functions and acts just like a natural tooth. It doesn't need any more maintenance than a natural tooth would. It just needs your regular flossing, you're using of your interdental brushes, you're brushing, seeing the hygienist regularly, all the stuff you would do for your teeth, because the crown is covering a tooth, but the tooth underneath it can still get problems if you don't keep it nice and clean. So just like you would look after it with your own teeth. So treatment normally will take 2 appointments. The first appointment, anywhere around about 60 minutes. And then normally 2 weeks later, and that next appointment's about 30 to 40 minutes, depending on how many crowns you're having done. Obviously, if you're having lots of crowns done, maybe for a cosmetic procedure where you're having some front teeth, then it may take a little bit longer. But typically for one crown, it's about a 50 to 60 minute appointment, followed by a 30-minute appointment to fit it 2 weeks later. One, aesthetics, so building the tooth back up again to look and function like it was previously before it was filled, and then also strength. So typically the main reason why we provide crowns is because the tooth has had a big filling in the past or has cracked, and if you replace that tooth with another big filling, it will crack again. So generally crowns are a much stronger material, generally it'll last you a bit longer than putting a filling into it. Normally we would want a crown to last 10 to 15 years. And it means then it's much stronger, so if you're a clencher of your teeth, or you eat lots of nuts, hard foods, things like that, it will stand up better to those forces than a filling would do. So patients who mainly benefit from crowns is patients with big fillings. It generally does tend to be the older population. Dentistry in the 60s, 70s, 80s was a lot more aggressive, big fillings in teeth, and big silver fillings, they're great, they last a long time, 30, 40 years, but then what does happen is that eventually they'll start to crack. A very common complaint with patients in the 60s, 70s is that they come in and they've broken a tooth, and it's generally with these big silver fillings, and this is where onlays tend to come in quite well over crowns, because we can, instead of having to prepare the whole tooth for a crown, we can just take the filling out and then we kind of pop an onlay on top, which it stays in by the glue, so it's much more conservative for the tooth tissue itself. Kind of main risks or downsides of crowns. Cost is a little bit more expensive than having a filling done, so generally a crown costs around about £660, but normally that'll last you 10 to 15 years generally. So downsides, roughly around about 20% of teeth which have a crown on them the nerve can die off, and sometimes they can need to have a root canal treatment. That's generally because those teeth have had big fillings in the past, or they've been heavily traumatized, they've had a big filling, they've cracked, whatever it is. But we can always, save a tooth which has had a crown when the nerve dies. We can always go through the crown and do a root canal. We can't save teeth which break in half. So, we always try, and if a tooth cracks or if we think it's going to break, it's better to consider crowning the tooth, because then you have at least a strong foundation for that tooth if anything else in the future does happen. A crown or onlay typically costs around about £660. If you're on the plan, then normally you will get a 10% discount off any treatment as well. So typically how it'll feel for the patient, normally when they come in for a crown, if the tooth has broken, generally patients will have a sharp edge on a tooth where they might be getting some sensitivity. And that's normally then a precursor for doing the crown, and we'll have that conversation with you. Generally we can get you out of pain. We normally put a little temporary in or something, or smooth off a sharp edge until we can get you back in for the crown appointment. The procedure itself, it's just the same as really having a filling. It's a bit longer, but you'll still be numbed up the same, so you won't feel any discomfort or any pain during the procedure. While the temporary is in, again, sometimes you can get a little bit of sensitivity with it, but normally it feels just like it would do with a normal tooth. You just have to be a little bit more careful of what you eat. You can clean it normally, and then once the crown is in, like we said, it'll feel just like a normal tooth. You'll be able to floss around it, you'll be able to clean around it, you'll be able to eat on it. So generally it feels much better, much more comfortable than maybe a broken tooth or filling which was in there in the past. So main benefits that come with the Ewan Bramley dental care, I think first thing is materials that we use. We use state-of-the-art modern materials, so from kind of start to finish, the procedure we use a digital scan, so you don't have any more impressions or molds when we make the crown, so no more gagging. It's all done digitally. Everything is designed digitally, so it means that it's more accurate and then 3D printed, so it's as accurate as it can possibly be. We have an in-house lab technician, so Phil, and he's basically an artist. He makes things look absolutely gorgeous. He can add in lots of different colors and tints to really kind of match the crowns in really well with your natural teeth. Also time, generally we do spend a little bit longer with patients as well, so one of the benefits sometimes if you're a nervous patient is that things in the past can be a bit rushed, whereas now we tend to book a longer appointment so that if you've got any concerns or if you're a bit anxious and nervous, we can go through the procedure in detail with you, we can explain it to you, we can make you more comfortable, and that generally, a lot of patients, that tends to be one of the main benefits why patients come back to you in Bramley, because of being able to provide them with that time, care that patients need and they want, because not everyone likes the dentist, most people don't, so that's one of the important things here. But with crowns in particular, I think it's probably the best thing that we do here, because of Phil, the lab. He is excellent, and it's not many practices in the country have an in-house lab technician, so it really is a big bonus to the practice.